Hi guys, today I'm going to talk about the median nerve. Median nerve, as you see here, it's one of the main branches of the brachial plexus. In my previous video, I showed you the details about the brachial plexus. Now I'm going to focus on the root values of the median nerve, how it's taking the course along the whole length of the upper limb, which muscles are supplied by the median nerve, and where is the vulnerable sites of the median nerve. So this is the median nerve. As you see here in the axilla armpit, we have an M-shaped nerve. So laterally we have muscular cutaneous. Medially you can see the ulnar nerve. In the middle we have median nerve. If you go back, you can see that medial nerve is coming from both lateral and medial cord. This is the lateral cord, this is the medial cord. If you go back more, you can see the lateral cord is coming from both superior and middle trunk, and also if you go backward you can see that it's coming from the inferior trunk. So all three trunks are contributing to form the median nerve. And if you go backward, you can see that superior, middle and inferior trunks are formed by all these root values C5 to T1 spinal nerve. So the result is that median nerve's root values are all C5, C6, C7, C8 and T1 spinal nerves. All these 5 spinal nerves come together and make this median nerve. Now I'm going to show you the length of the median nerve, how it's taking the course along the whole length of the upper limb. So if you look at here, this is the plastic model. If you look at closely, this is the medial view of the axilla or armpit. Here we have the axillary artery. Around the axillary artery, we have the M-shaped nerve. So if you look at closely, this is the M-shaped nerve here we have. And laterally, it forms the muscular cutaneous. Medially, it makes the ulnar nerve. And in the middle, here we have the median nerve. So the median nerve is in the middle of this M-shaped nerve. It runs all the way down, traveling alongside the brachial artery. So this red one is the brachial artery. It's traveling alongside the brachial artery on the medial side of the arm. So if you trace it down, you can see that it's coming to the anterior of the cubital fossa. Anterior to the elbow joint, we have cubital fossa. So here we have the median nerve. As you see here, it becomes deep, getting deep, passing deep to this muscle. If I put the muscles back into the sides, you can see here we have this muscle. It is known as the Pronator teres. So it passes deep to the head of the ulnar and humeral head of the Pronator teres. That becomes deep. And again, if you look at here, it goes down to the forearm. Again, it becomes deep, more deep. Goes to the deep of this muscle, flexor digitorum superficialis. You can see here the course of the median nerve. So it runs all the way down deep to this muscle, flexor digitorum superficialis. I'm going to put it back. You can see that the median nerve is covered by the flexor digitorum superficialis. So it's becoming deeper and deeper. So if you look at here, here is the wrist. Here we have the flexor retinaculum. It is covering the carpal tunnel. So median nerve passing underneath the flexor retinaculum, passing through the carpal tunnel, and you can see it gives us some branches here at the hand. So you can see it supplies the muscles here and supplies the skin of the hand. So I showed you the whole course of the median nerve. It's on the medial side of the arm, and it's anterior to the cubital fossa. Anterior arm, it becomes deep to the pronator teres, and it becomes more deep to the flexor retinaculum, flexor digitorum superficialis muscle, and you can find it here at the wrist. Before getting into the carpal tunnel, you can find it between these tendons. Here we have the flexor digitorum superficialis and flexor carpi radialis longus tendon. In between these tendons, you may find a tendon. And then it passes through the carpal tunnel and gives off some branches here. So this is the core course of the median nerve. So which muscles are supplied by the median nerve? At the arm, it does not give any branches to the muscles of the arm or skins. So it runs all the way down, and when it comes to the anterior forearm, it supplies most of the anterior forearm muscles, except 1.5 medial muscles. So medially here we have, if I put the muscles back, medially here we have this muscle, flexor carpi ulnaris, this one, and ulnar half of this deepest muscle, flexor digitorum profundus. So all these two muscles are supplied by the ulnar nerve. Rest of the muscles are supplied by the median nerve. So median nerve supplies most of the anterior forearm muscles. So, and then at the hand, it supplies only the thenar muscles at the base of the thumb and 2 lateral lumbricals. If you look at here, we have lumbrical 1 and 2. 2 lateral lumbricals plus thenar muscles are supplied by the median nerve. So these are the muscles that are supplied by the median nerve. What about the skin? It supplies the skin of the 3.5 fingers, 3.5 lateral fingers. I mean, the skin covering the thumb, index finger, middle finger, and the lateral half of the ring finger. They are supplied by the median nerve, and corresponding palm here. So it's supplying the lateral part of the palm, skin of the lateral part of the palm. The key point is that the median nerve also extends posteriorly up to this joint. It's called the deep. Sorry, I'm going to show you closely. So it extends posteriorly to the back of the fingers up to here. This joint is known as the pip and dip. Distal interphalangeal joint. So it supplies also the skin at the back here. So what is the vulnerable sites? The meaning of vulnerable sites, it means that it can compress by the other structures. As I showed you before, when the median nerve getting into the forearm, it becomes deep. It passes between the two heads of the pronator teres. It passes between the ulnar head and the humerus head. So one of the most important vulnerable sites for the median nerve is here. When it passes between the two heads of the pronator teres, it's more vulnerable to be damaged because it can be compressed by this one. The other side of the vulnerable side is here in the carpal tunnel. As I mentioned before, the median nerve passing underneath the flexor retinaculum, passing through the carpal tunnel. So it can be compressed by the tendons of the flexor tendons, flexor digitorum superficialis, flexor profundus, flexor digitorum profundus. So we have 9 tendons plus median nerve, 10 structures passing through this narrow carpal tunnel. So if we have an inflammation of the tendons, so they can compress the median nerve, and which results in causing the carpal tunnel syndrome. So the other vulnerable site for the median nerve is carpal tunnel here. Thank you so much for your attention.